All right, so we'll kind of just get started now. I'm gonna kind of give a quick introduction before we do. Hello, everyone. Welcome to another dental shadowing, virtual shadowing session. I know it's been a while, but it's good to be back. Thank you for tuning into our session today. My name is Preet, and I'm a part of the Dental Shadow Z board. I will be facilitating today's session with Dr. Patel, who is a cosmetics dentist. Dr. Patel, thank you so much for taking your time out of your schedule and being here with us today. And whenever you're ready, I mean, the floor is yours.
Awesome. Thank you so much. First, I just want to say thank you to you guys for giving me the opportunity to come speak to your group. I appreciate it. Like I was saying, this is such a cool concept of what you guys are doing, and I'm wishing you guys some awesome success in the future in your own paths, if it's dentistry or beyond. So, but yeah, I'll go ahead and get started. So again, my name is Dr. Tejas Patel. A lot of people say Tejas being in Texas, but it's pronounced Tejas, but I'll respond to any which way you call me. Um, I'll tell you a little bit about myself. Let's see. And so I grew up, I'm going to kind of start off in college and in my upbringing, but I grew up in Houston, Texas, and I went to elementary school, middle school, high school, and college in Houston, Texas. And I started off at a small private university called Houston Baptist University. I think it's renamed Houston Christian University. And I was paying my way through college, had to work through college, and I had heard that HBU had a really good pre-med program, and I had a cousin who was going there following to go apply to med school in the future and stuff like that. And so I thought I always knew I wanted to do something in healthcare, in medicine or dentistry, or just something in healthcare to help people, and that was my goal. And so I started at HBU, small private institution, super expensive. And I was like, man, this is getting very expensive. I need to save some money. So I transferred to the University of Houston, almost pretty much for financial reasons. And and during that time in high school, I started to volunteer at a hospital just to kind of see what people did in the medical setting, pharmacy setting. When I started college, I was like pre-med, then pre-dent, then pre-chiropractic, then pre-physical therapy, then pre-optometry. And so I was really trying to find my way in medicine to figure out where I wanted to be. And in college, I did shadow at a dental office. And I was like, man, this is pretty cool. Like the hours seem pretty cool. They're getting to help people. It's like medicine. They're working with their hands a lot. And so I decided to apply to dental school. And I applied to dental school and chiropractic school. And I applied to all three Texas schools for dental school. And I only got accepted to one, which is the University of Texas Houston Dental School. And before I got my dental school admission, I actually got accepted to chiropractic school. And I really thought I was going to go. I was like planning, had the roommate lined up and everything like that. But thank God I got the acceptance to dental school and decided that's really truly what I wanted to do. A little bit about my major, because some people find this interesting. Like I started off as a bio major, and then when I transferred schools, I was pre-dent, so I was ta always taking all the prereqs and stuff like that. But I really enjoyed Spanish. And when I was in college, I don't know, I just thought like, okay, if I'm gonna spend like X amount of time studying sciences for dental school, whatever, like I'm gonna take something I really like, and I really like the Spanish language and culture and stuff like that. So I actually majored in Spanish. Um, and this is like 1998, so I was able to, do my DAT, do my interview, get accepted to dental school with just my prereqs. And so I have a doctorate degree, but I don't have a bachelor's degree. So a lot of people are like, are you a real doctor? But so it was just a program where I was able to finish all my prereqs and get in based on that. And obviously like academics and GPA and all those things. And so I'm not like an amazing student. I mean, I'm an avid student, avid learner. On paper, I was probably like a B plus student. I don't remember my GPA. I remember my DAT score being kind of average, and I feel like the perception part of the test that was on the test, I'm not sure if it's still on the test. I did really well on that. Like I said, college for me, I lived at home to save money, and I worked part-time. I worked at a bookstore for a really long time. I worked as a TA for a little bit, and then I worked at a cafe for a little bit. But I was either like working, studying, or going to school, and I kept myself pretty busy. And so I feel like when I got to dental school, that was kind of my quote unquote college experience when I actually moved out, lived with a roommate in an apartment on my own and things like that. And again, I got accepted to the University of Texas Houston dental branch, and like I've always had to work hard for school, and in dental school that was like another level. It was super difficult, very challenging. Um, it was one of those things like going into dental school, I couldn't wait to start helping people and working with patients, but that doesn't come till like, your junior end of your sophomore, junior year when it really kicks in. And so, those first 2 years are just so science-based, academic-based, from pharmacology to biochem to, it's really heavy on the academics the whole time, but especially those first 2 years. And so a couple of lessons I learned in dental school or like takeaways are just definitely like time management is huge. I was able to work in college, but there's no way I could work in dental school or having like a part-time job because it's just so intense, the workload and everything like that. I made some of the best friends I've ever had in dental school. I mean, you are with usually a small to mid-sized group of people that's pretty intimate. You guys are going through the same kind of process. So there's a lot of bonds that are made, which is a beautiful thing. Um, a couple of things I wish I did more or spent more time doing in dental school was when it got to the clinical aspect, I really wish I took the time to maybe, I don't know if it would be electives or some way to get more exposure to certain procedures that I wish I would have brought to when I first started practicing dentistry. So say for example, like in dental school, if I had the opportunity to learn more about like removing or extracting wisdom teeth, like I wish I would have taken that under the guidance of having your dental school professors there, because that's valuable there too. You have the patients, you have the guidance, you can take your time, you can learn, you can make mistakes, and learn from those mistakes and so forth. So you kind of have that umbrella to kind of, cover you. And so there's certain procedures that I wish I would have, maybe spent a little bit more time learning about orthodontics or wisdom teeth or even endodontics or root canals, where I got my basics, but I wish I would have taken it a little step further. Um, my favorite classes in dental school would be anything related to patient care. So if it's like communication, psychology, anything that had to do with like human interaction, I really enjoyed those types of classes. I never really won much awards like in school at all, but I did get the public health award in dental school. One of my favorite experiences was I got to travel to Nicaragua with a few of my fellow dental students and one of our public health dental directors, and he was a pioneer in dental public health he was like top in the world. And so I got to spend time with him on this trip as well as go serve in a rural community in Nicaragua, and we provided basic dental care. And that was my first mission trip dental volunteer trip, mission trip, however you want to call it. But I literally have probably done since then at least 10 trips, to Haiti, to Africa, to South America. And a little side note, it's been pretty cool to travel like a love of traveling and dentistry and helping people like all into one. And it started in dental school. And so I was designated like the team leader. So I helped like figure out like what supplies we're taking, inventory, help coordinate logistics and stuff like that. So that was like one of my favorite experiences in dental school. And that happened in my junior year of dental school. So some certain things I would advise for anyone interested in like dentistry, or pursuing anything in healthcare, especially dentistry though, is like definitely like time management habits are key. But also dentistry is hard in the sense it's hard, it's physically demanding, because you're kind of in like weird, odd positions that are not natural for the human body. Um, it's also emotionally taxing, because you are dealing with people at different levels. They may have anxiety, they may not. Things could go well, things could not. So emotionally, it can be taxing. And it's also very, very, very detail oriented. Like when we talk to carpenters or builders, they work on feet and yards, and dentists work in millimeters. And so, the precision aspect of it, the detail orientedness of it is a very, very high level. And I feel in dental school, that can be a little stressful when you're like initially learning to work with these details. It does take a little bit of time to realize like, what's the big deal? It's like just a millimeter, but in dentistry, a millimeter could be the difference between something good or something, bad. And so, like I mentioned, in dental school, I did shadow at a dental office, and that was super valuable to me. I never worked as a dental assistant, dental hygienist, or anything like that, but that's always, I think, a great option if people have the time or have an off year or something like that. I did take a DAT prep course. I did, I think Princeton or Kaplan or Princeton Review, one of those back in the day, and that was valuable for me. And I always think like in dentistry, if you ever think you're going to, after you graduate, start your own business or even just like work with other people, it's valuable to understand business and business concepts. So sometimes I tell college kids, if you don't haven't decided your major, like business is, I think always a good thing, especially if you're going to go into dentistry and do private practice. A lot of dentistry is going digital, so I'm finding myself like having to learn more about like CAD CAM design, or things that were done analog in the past or with your hands are now done on computer. 3D printing, things like that. Those are things that would be of interest to learn about if you're thinking about pursuing dentistry. Hand skills are, I think, very, very, very important to make. I don't want to say between a good dentist and a bad dentist, but like the better your hand skills are, the better you're able to do your daily deeds, of what you're working at. And so growing up, I played the violin. I didn't appreciate that at all when I was growing up. I was like, why am I doing this? But now I'm like, man, working with both hands and using both sides of your both sides of your brain, coordinating your movements was super valuable to me. Like, with I mean, as dentists, we kind of are ambidextrous, and in the degree of we usually have one thing in each hand, and you're usually working with a mirror in your non-dominant hand, and whatever you have, like a handpiece or an instrument or something in your dominant hand. And so using that indirect vision, and there's like so much perception to it, and also hand skill. So sometimes people ask, hey, what should I do to develop that? I mean, if you are into art, drawing, painting, any type of art classes, origami sometimes is good because it does have to do with perception and depth of field as well. And even jewelry making, just like making bracelets, or things that get you working with your hands with like fine details, I think is always valuable. Myself, I'm still trying to get better at my photography. Being a cosmetic dentist means that I'm trying to take pictures of my work to show to my patients or to future patients, and to kind of promote our work. And so photography, I think, is a up and coming skill that dentists will have to get better at. And then if you're opening your own business or just work, I mean, in dentistry, even if you work for someone else, like there's a sales aspect to it, and then the psychology of dealing with just people on a daily basis, communication and things like that. So these are all things that are, super helpful for learning about on your journey to dentistry. And so after I graduated dental school, first thing I'll say is I graduated out of like 60 people in my class. I was like number 58. So like I barely made it out of there. So like I am proud of that because of how far I've come. But also I'm proud to tell I also am honest to people, like it is very hard. Dental school is hard. It is challenging. Like there's so much that's going on that taking the time to focus on your physical health, your mental health, your emotional health, all of those things are important, especially if you're in an environment like dental school, which can be taxing and stressful for a lot of people. And that continues on as a dentist as well. So I started a practice from scratch in Austin, Texas. Like I said, I'm from Houston, so I moved to a whole new city, like left everything. Me and my wife decided to move to Austin. We started a practice where we didn't know anyone in a town where we didn't know anyone, and I thought it was going to be all roses. And it took a while to get like really stable and things like that. But I'm happy I did it because from day one, like I've been I did work as an associate at a clinic for about 6 to 8 months while I was kind of getting set up. But since then, I've been the boss, which can be good or it can be bad. But it's been really good to be able to call the shots and things like that. As I graduated with a DDS degree, which allows me to do all aspects of general dentistry. And I've been practicing dentistry for 20 years. And each of those years, I've taken to like about 50 to 100 hours of CE courses every year. So getting the dental degree, getting into dental school is like, oh man, I made it. No, it's like, okay, you made it, but like you've got this really long road in front of you. And then after you graduate, you're like, yay, I'm a dentist. But then you're like, oh man, like there's the continuing education never stops. And so I've always tried to keep ahead of like with courses, techniques, procedures, what's new, and always continue to grow myself. And I feel like the CE courses, and I actually did have a dental business coach for many years of my practice. Like those two things were essential in my development post grad. So I think those things have been helpful each step along the way. But I did the practice thing. We got really good at a big general practice in a suburb of Austin, and then I wanted to grow the practice, and so I actually bought a second location, hired different doctors, and really grew my team, and had two offices that were really thriving. And then about like I'd say 7 years ago, I was really burning out. Like it was a lot of work. It was just a lot to manage all these team members and doctors. And I was like, I can't do this. And so I decided just to sell one office and downsize. And this is pre-COVID. And from day one, for my dreams of dentistry were always to focus on cosmetic dentistry. Like in dental school, I had a speaker come in. He was this high profile cosmetic dentist, educator. He came in, he was showing cases to us, and I was like blown away like with these before and afters. And I was like, I want to do that. And at the end of his seminar, he was selling a book. I bought that book, and that was like my holy grail. He like profiled like 10 different dentists and their practice, and they were all cosmetic dentists and like changing smiles and like changing lives. And I was like, man, I wanted to do that. And when I started my practice from scratch, I tried to do that, but I didn't know anyone. I didn't know anything about business. I didn't know anything about marketing. And so I ended up kind of like getting on the insurance plans and doing general dentistry and always doing cosmetic, but always focused on the general. And so it was really good because it gave me such a good, strong foundation of general dentistry that now if someone comes in for a smile makeover, but they have like some other general dentistry problems, I can deal with that. So I just took a long, windy path to get to where I wanted to. And so today I have the practice of my dreams. I focus on cosmetic dentistry. I have one location. I have 3 dental chairs. I have 3 team members. We're strictly fee for service. We don't take any insurances. I don't even have a dental hygienist, which is unheard of. We refer out for that and work with other general dentists in my area to take care of that. And the crazy thing that happened since COVID is because of social media, like over 50% of our patients come from out of state, which is crazy. That was never the intention. Like my intention was to become like a really well-known cosmetic dentist in Austin. And then what happened is people started traveling from Dallas or Houston, like other cities, and then people started wanting to fly in. And so over the years, we've become a destination cosmetic practice. And we have a really big social media following. We have like 2.8 million followers on TikTok, about 98,000 on Instagram right now, I believe. Um, I consider myself a dentist, a cosmetic dentist. I also now consider myself a content creator. According to the numbers, I guess I'd be an influencer. I don't consider myself that, but that's what I guess I'm in that category. I'm kind of known as the TikTok cosmetic dentist. And then a couple of years ago, I started creating online courses for dentists that are CE approved to help teach the procedure that I've gotten known for. And that's the porcelain veneer procedure. And then also, we've got pretty prominent on social media where I have a lot of dentists asking about that. So I created a course around that as well. So I guess I'm a dentist, cosmetic dentist, educator, a content creator, influencer, which has been really cool because dentistry has opened a lot of these doors for me, which I'm super thankful for. And so my day as a cosmetic dentist, I focus on like the porcelain veneer procedure, the porcelain crown procedure, smile makeovers. So my day is usually spent like starting a case, which is like prepping a case, seating a case, which is like finishing a case. And that's like kind of like in my column of my schedule. And then in our other column, my assistant's usually starting consults, either virtually or in person. We're doing post-ops on cases we've finished or in the middle of. I'm also working closely with my dental lab, and that's the thing about cosmetic dentistry is it's not just my team, it's not just the patient, but there's a third party. There's a dental lab or a ceramist who's part of that equation to help complete the smile. And so I'm working intimately with them about designing the smile, how it should look, and kind of getting their feedback on how things are going with these cases because they're actually providing the actual porcelain to me based on the specifications I've given to them. And in my practice, like we really focus on full smile makeovers. So it's usually like the full top teeth smile, which is 10 teeth, or the full top and bottom, which is 20 teeth. So we've really niched my practice down into like the main procedure that we want to do, that we love doing, that we enjoy doing, that we've figured it out. And for us as well, it's the most profitable for my practice. So we see a high volume of patients. We're a destination practice. We exclusively try to have people fly in just for 2 visits, so they're not having to come back and forth, which means that there's a lot of pressure and stress of getting these things right. And so we really have to have our systems and workflow dialed in. And that's part of like understanding like business, management, leadership. All of those things come into play as me as the dental person, the dentist. So I'm not only the technician in my office, I'm the CEO, I'm the CMO, I'm the like you name it, I'm HR. And so there's a lot of hats like I wear as a dentist, not just being the person who's providing patient care. And so today I'm kind of going to go through a couple of cosmetic dentistry concepts. I'm going to talk about the top cosmetic dentistry procedures. I'm going to talk about the porcelain veneer process because again, that's mainly what I do. I'm actually going to talk about smile design a little bit as well, and then I'll show you guys a couple of cases. So a disclaimer, like I'll say this 1,000 times, I'm not perfect. I do smile makeovers. If you follow me on Instagram or TikTok, like we're going to show beautiful work, but that's our highlight reel. I've had to remake cases. I've had patients who've had issues while they're in treatment or after treatment that we've had to continually work on or fix. Everyone gets fixed, but it's not always the 2 appointments. It's not always exactly going according to plan and things like that. So I'm the first person to say, hey, like I've made mistakes. I always try to learn from those mistakes, but it's just the nature of being a human. So a couple of things about cosmetic dentistry today. It's a really interesting thing because of social media, because of plastic surgery, because of Facetune, because of filters, I really feel like the beauty standards are definitely evolving and changing. And I don't know if that's a good thing or bad thing, but we're essentially changing someone's smile when we do cosmetic dentistry and in trying to make improvements. But the standards or expectations of what people are expecting nowadays is is really wild because they can see something on social media, but it might actually not be reality and what could be achievable due to science and the capabilities of what we're able to do with our materials. And so that's just something that I'm understanding more and more as the years progress. And then for me, doing a successful cosmetic veneer case means I've listened to my patient's goals, and I've provided them with results that they're super happy with, that look amazing, and that's going to last an extremely long time. That means we've nailed the case. Like everything looks awesome, they're happy, we're happy, and they're going to get to wear it for 10 to 15 years, if not longer. So part of really having successful cases is balancing my patient's goals with my treatment plan or the tools I have in my toolbox, and also designing the smile that my patient wants. And so veneers are the main procedure I do. So porcelain veneers are thin shells of porcelain that are bonded to the front surface of the teeth to change the color, shape, size, basically the aesthetics of someone's smile. We usually do, like I said, 8 to 10 teeth to start off with, which is a full smile versus just 1 or 2 teeth. So we're really having a big canvas when we're working on someone's smile. So people who could benefit from porcelain veneers would be patients with small teeth, people with gaps between their teeth, teeth that are angled in or set back, teeth that are straight, but they're not happy with the color. Maybe they've tried whitening and not gotten the success that they've wanted. People who are done with braces and still, or Invisalign and still not happy with their smile. People who don't like the shape of their teeth, people who don't show enough of their teeth, people who want a broader smile, a bigger smile, or someone who's actually started maybe composite veneers and they want an upgrade to porcelain veneers, or people who have had chipped teeth and had composite repairs that are failing and they want another upgrade. So the main procedures that are in my tool bag as a cosmetic dentist would be teeth whitening, teeth straightening, be it I would provide Invisalign, but that could mean braces from the orthodontist, teeth contouring, which is shaping the teeth, dental bonding, which is fixing little chips or edges with the teeth, gum contouring, composite veneers, porcelain veneers, which is my main kind of forte, porcelain crowns, porcelain bridges, and dental implants. So the last four are kind of like where the majority of the procedures I do kind of fall within that realm. I used to do the surgery for dental implants, which was very exciting. My practice has kind of drifted more towards the veneers, and that's what we have our schedule kind of based around. So for efficiencies, we're kind of focusing on that realm. But the bridges and implants are options for people who are missing teeth, especially with their smile. So I'll kind of go through the veneer process. Again, I talked to you about my day. I'm either consulting, prepping, seating, or post-oping. So I'll kind of tell you what happens at each of those steps. So, during the consultation, I'm reviewing patient goals, smile design. We're taking impressions. We're taking photos. We're really talking about this planning phase, this exploratory phase of like, hey, how do you want your smile to look? What do you like? What you don't like? Then a few weeks later, I see them for their preparation visit, where we get them comfortable. We do any prep or shaving to the teeth that we need to make room for the veneers. We take impressions, and then we place temporary veneers. The patient then wears the temporary veneers for a few weeks. During that time, I'll check in with them to make sure they're liking the way things look, make any changes to the temporaries or to my instructions to my lab. They wear the temporaries for a few weeks, then come back. We get them comfortable, remove the temporaries, try in the permanent porcelain, make sure they like it, then permanently bond or secure those to the teeth. And then afterwards, we'll see them for a final check, do our photos, any bite adjustments, any fine tuning that we need to do to the final result. So that's kind of like the porcelain veneer process from start to finish. So understanding smile design, I think it's an overlooked aspect within dentistry. And this could go for if you're a general dentist. Let me take that. Any dentist nowadays almost has to be familiar with cosmetic dentistry, because if you're doing anything with the front teeth, that's kind of cosmetic, right? Because it's in your appearance. Or even if you're doing dentures or something where you're changing someone's smile, you have to understand smile design. And so I'm going to kind of talk to you guys about some uh, like like 30,000 foot view ideas about smile design. But with the smile design, we're always thinking about beginning with the end in mind. So I'm almost, sometimes like I feel like a project manager, because I'm trying to like coordinate what my patients want, or like a decorator, like an interior designer, smile designer. Like I'm trying to coordinate what my patient wants, what they envision, and what we have in our toolbox and what my lab is able to do, and trying to create this collaborative effect where we get the results where everyone's happy with it. So that's always beginning with the end in mind, translating my patient's smile goals into their smile design. And that includes using a diagnostic wax up from my lab. And that's just a design that they make based on the instructions I've given them about what the patient wants with their smile. So I'm going to kind of run through the design principles each one by one. So first, we're going to review our patient goals. What do they like about their smile? What don't they like about their smile? What do they want to fix? Where are their inspiration pictures? I always say inspiration, not duplication, because there's a lot of people who have that expectation of like having Kim K's smile on their teeth, but they have a totally different lip line or size of teeth and things like that. So it's just really tempering expectations, but then also showing them what we're able to do. As part of doing veneers, veneers are kind of like a one-stop quick solution for a lot of people, but sometimes we have to look in our toolbox and decide maybe this person needs something like Invisalign prior to veneers. Maybe they need to try Invisalign and whitening prior to veneers. Like veneers for us is like when people have tried these other things and they're still not happy, that's when we reach into the toolbox to get the veneers. But a lot of times we'll have to think about if people's teeth aren't quite straight, doing some sort of alignment through Invisalign first and then doing veneers. So the size of the centrals are the size of the front two teeth. And that dictates, when we're designing a new smile, that dictates the size of the teeth in general. So if we have really short teeth, I'm going to have my lab maybe add length to create the new desired length of the teeth. But we always use like the front two teeth as a guideline or baseline for the rest of the smile. We can make pretty white teeth, but if the gums look like trash, it's not going to look good. If the gums are uneven or all over the place and we're redoing someone's smile, we definitely want to make sure the gums look healthy, are healthy, and look aesthetic as well, and balanced and symmetrical. The shape of the teeth is something we can work with veneers. If people want like a straight kind of masculine look, we can do that. If people want a very feminine, soft look, we can do that as well. This is where things have changed a lot. If you asked me 5 years ago what the most popular color was, I would say this BL2 at the bottom, which is a very natural looking white smile. Over the years, I've had to do this bright white, chiclet white, paper white look, and that's just totally because of personal preference. And so I feel like half of our clients want like a natural white look, and the other half want something just super kind of fake looking, super bright. I think it's kind of telltale with plastic surgery as well. You can see people who get Botox and fillers and things like that look very natural where you can barely tell. And then you can tell people who have really done a lot of those types of services and they want people to know that they've had those done. And I feel like with cosmetic dentistry, I'm seeing that as well. The fullness of the smile is the broadness of a smile. So if we did braces or Invisalign, we want to get the teeth pretty broad where we can see like 8 to 10 teeth. And that's something with veneers we can definitely help. The midline is an imaginary line drawn down the middle of the face that bisects the nose, upper lip, and chin. And so with the midline, we want to make sure the midline's pretty straight. If we can match it to that imaginary line, that's always more aesthetically pleasing. That's something we're looking at when we're designing a smile. The occlusion is just the term that we use to say how the top and bottom teeth meet together. And so we want to make sure if we're adding volume to the teeth with these porcelain veneers that we're not interfering with the occlusion or the bite, and that the patient has to be comfortable biting and chewing and functioning with these new veneers that we've added to their teeth. And then the smile line just means that we want the edges of the teeth to kind of come to like a more lower point in the front and kind of taper up as we get to the back of the smile. So we'll look at a couple of cases. So this is a patient who came to me from a different dentist. This area, these two, the left central and left lateral are actually missing. So this is a temporary bridge. And so the patient came to me saying that this is the best that the dentist could do. They've tried in the permanent, this is a temporary bridge. They tried in the permanent bridge before gluing it on. She was unhappy with it. They tried several times, couldn't get it right. So she came to our office to see what we could do. And so I told her, if you only let me do the 4 teeth like you've had done, I can only get such a good result. If you allow me to do the front 6 teeth, I have a better canvas to work with. I can create more symmetry, more balance, and it's going to look better. And so she allowed us to do a bridge on those 4 teeth that where she had a temporary bridge, and then add 2 veneers. And then like collectively, we have a brand new smile that looks pretty amazing. And so I'm as further and further in my career, I'm noticing I'm doing more revision type cases where patients were unhappy with the prior treatment that they had done. And so that's part of the reason why I do a lot of the education stuff is like, I think we all need to just raise the standard of what people are learning to help provide better care for our patients. And that comes with aesthetic dentistry or cosmetic dentistry as well. Here's a patient who unhappy with her smile, flew in from a different state, just had a lot of wear, chipping to her teeth, discoloration. We can see some flatter edges on the teeth. We wanted to give her like a nice, like a little bit more of a brighter smile, nice, soft, feminine look. She's in that nurse injector space, cosmetic space. And so we're able to redesign her smile with porcelain veneers and improve the size, shape, symmetry, color, alignment, and overall just give her a pretty smile. And then one other case. So this is one of my favorite cases. We just did it recently. Old composite veneers, staining, discoloration. Kind of you can see that brown discoloration between the teeth or at the margins or edges. And we're able to do a set of 10 veneers, porcelain veneers. So a different material, a more long-lasting, higher quality material to give her an amazing result in the end. But again, a lot of those concepts I was talking about, midline, lip line, fullness, alignment, all of those concepts are the storyline between that top and bottom picture. You know, like all of those things I was saying are the details that go into making such a smile that you see. I always like talk to people about the education stuff I do. I do online courses for dentists. I mean, I guess it could be dental students, pre-dent, whoever. It's really open to anyone. The veneer masterclass I have is an over-the-shoulder online course where people get to watch. We recorded 3 smile makeover veneer procedures where people get to see how we do veneers from start to finish. And so I think it's valuable as an over-the-shoulder kind of online course. And then here's all my contact information, my email, my Instagram. If you don't follow us, I'd appreciate a follow. On TikTok, the name's a little bit different on TikTok. And then that's my website. And then the bottom one is my education website. And so that's what I got for you guys.
Thank you, Dr. Patel. We'll go over to the Q&A session. So if anybody has any questions, this is the time to ask in the chat. We'll give it a couple minutes so people
Yeah,
can
yeah.
type out their questions.
Thank you.
And then, yeah, just type it in the chat and then we'll read it off. So, Prit's gonna be back in a moment, but we'll read it one by one so that way you can answer each question to the fullest.
Awesome.
I'm just gonna wait like a minute while everyone types it out. Okay, we're gonna start with the first question. Prit, whenever you're ready, go ahead.
Yeah. Hey, so I'm just gonna kind of read off the questions from the chat. One of the first questions that we had was, As a cosmetic dentist, what has been your experience on the longevity and lifespan of veneers?
So I mean, so I've been doing this 20 years, and the longest set of veneers I have had that I've done in a patient's mouth have been 20 years. And so the materials, especially if it's porcelain veneers, we tell patients they last anywhere from 10 to 15 years, but in reality, they're probably going to last a lot longer. But the longevity is based on many factors and how well the patient takes care of their teeth, like brushing twice a day, flossing once a day. If they're designated to wear like a night guard or mouth guard, if they're wearing that. And as long as they go in for their cleanings, ideally twice a year, that should improve the longevity of porcelain veneer. So I'd say, 10 to 15 years is the average, but most likely it's going to be longer. But we usually say 10 to 15 years as a guideline.
Okay, thank you.
You're welcome.
Another question we had was, what kind of cement do you use?
So to glue on my veneers, I use a cement called Calibra resin veneer cement, and it's made by a manufacturer called Dentsply. And doing veneers for a long time, it's important to have like a really good cement, but it's also good to have a really good, what we call a bonding protocol for how we bond the porcelain or an artificial material to a natural tooth structure. So I use Calibra, and the thing I like about that cement, and most veneer cements, is they do come in different colors or shades. So if I do feel like I need to tweak the final color or the final result, I can either dial up the color and make it a little bit brighter or tone it down if we feel like we need to kind of make it a little bit more subtle. So I do like that aspect of having a really good glue that I trust and that comes in different colors as well.
Uh, Moving on, another question was, how do you balance work life, social life, and family life?
That's a great question. That's a really, really great question. Like I mentioned earlier, like I wear so many hats. And so like, being CEO, being technician, being main dentist, being marketer, being social media person, like it's a lot to manage. I do feel like dentistry versus medicine is naturally more conducive for having work-life balance because most dentists take off on Friday. Like I had, today's my day off. Um, and so I think it comes with having boundaries, like I said, taking care of yourself, making time for yourself, making time for your family, making time for the things you enjoy and love outside of dentistry. I've had some really great coaches in the past that have really helped me achieve work-life balance. I'd probably say for the past over 10 years, I've taken anywhere from 4 weeks to 8 weeks off a year, worked anywhere from, you know, three and a half days to 4 days. Next year, my goal is to go down to 3 days of seeing patients and having one full day just to focus on the CEO, social media, admin, team stuff, leadership stuff, where I have a designated day. So as a business owner, I'm able to build like a work-life balance into my schedule, if that makes sense as well.
Uh, Moving on, another question we had was, what advice do you have for applications and interviews?
Um, Early, do it as early as you can, applications. Ask for recommendations well in advance, so you can have everything just lined up. If it's essay, letters of recommendation, whatever you need to do, I would do it as soon as you can, so you could be like one of the first to submit. Interview wise, I had a really, first of all, I'm gonna say I'm really lucky to be in the position I am because I know it was very competitive back then, 20 years ago. And I know it's even more competitive now to get into dental school. So I know it takes a lot. It's a lot of hard work. for the interview, I lucked out and I met like a super sincere, genuine dentist who made my interview like a conversation with a friend. And so I really lucked out. And so other of my classmates were like getting quizzed on like what tooth surface is this, what tooth number is this, like what instrument is this. And so I think part of the shadowing or observing in dentistry or even nowadays watching like YouTube videos and maybe having a little basic understanding of tooth numbers or common instruments or common procedure names. Um, I think that could be valuable in an interview in case if it does go that direction. Not expecting you to be an expert at any means, but having a familiarity. And also, I think having a really good why. Why do you want to get into dentistry? What's important to you? Of you become why is it important for you to become a dentist? And I think really having a truly genuine why is always valuable. And I think in an interview setting, just being yourself, as much as you can, not trying to be anyone else and trying to be yourself and being honest, I think is always helpful.
Is there anything that you dislike about your career?
Um, I mean, I think emotionally, like most dentists are very giving people and they just want to help people and help people want to get people better or improve their smile, whatever it is. And so it's not something I dislike. I just think it definitely adds a toll over time. Um, early on in my career, I really didn't like the numbers and business stuff because that was like kind of outside of my comfort zone. Um, Nowadays, the only thing I dislike is it's like in 20 years, I really haven't had many health issues, but like this past year, I've had like more back issues. And so that's the only thing I would dislike like currently of just like how like it's kind of getting a little harder to do like these longer procedures and stuff like that. But that just means I just need to take better care of my physical health.
Uh, the question we had was, do you allow shadowing in your office?
We do. I mean, I'm in Austin, Texas, so they obviously have to be close to Austin to come by. We do. We just have to coordinate, like we're open to it. As long as they're able to get transportation to and from, we're pretty open to it. And it's usually my assistant who kind of helps schedule them. But yeah, we're open to it.
Another one we had was, what kind of dental lab do you work with?
So I work with two really good dental labs. They happen to be in California. One is called Williams Dental Lab, and the other one's called Reliance Dental Lab. The Reliance Dental Lab I've worked with for my whole career. Um, like I said, having an excellent ceramist who works in a dental lab is essential in doing cosmetic dentistry. They actually are physically either hand making or milling or touching these veneers with their hands. And that's what we are installing in the patient's mouth. So it's really, really important to work with, like even if they're expensive, high end, it's super valuable to have that confidence that you can deliver like top quality results.
What was something you wish you did more in your undergrad years, whether that's academics or anything exposure wise, that would have helped you better be prepared for dental school?
So I probably would have taken more, like nowadays I know they have like courses on like time management and like um scheduling and things like that. I probably would have focused a little bit more on that. I mentioned like taking like the DAT prep course. Um, I probably would have spent more and more time going through that course load and doing as many practice tests of the DAT as I could. That's something I would do differently. Um, I mean, I feel like doing the pre-dent track got me enough of the science background, but if I wanted to take it to another level in undergrad, it would have been taking like biochem or things that were introduced into dental school that I could have, so like looking at that like first year course load and maybe seeing if there's courses that correspond to the undergrad of maybe getting a heads up or head start on certain of those courses.
Uh, is it difficult to do veneers on endodontically treated teeth?
Not really. So traditionally, dental school teaches if someone has an endo tooth, endodontically treated tooth, a root canal tooth, usually you'll do a crown on. I've done veneers on root canal tooth. It kind of just depends on the patient's situation, and what tooth it is. But it can be more challenging in the sense that root canal teeth, endodontically treated teeth are generally darker or like more brown because of the history of the root canal or the history of the whatever it was, infection or whatever. And so doing a natural tooth that's yellow in base next to an endodontically treated tooth, which could be brown at its base color, becomes a little bit more challenging with shade matching and getting cohesiveness with the coloration of the final veneer. So from a tooth preparation shaving standpoint, it's not as hard, because you have a little bit more leeway, but in the sense of matching colors, it can be a little bit more challenging. Yeah.
You mentioned that dental school was not easy. Do you have any advice on how to succeed in dental school?
I mean, I feel like everyone's different. But I would just, make sure you work on your time management. I think that's a huge part of it. And then asking for help if you need help. If there's resources outside of office hours, if there's any type of mentorship you can get in dental school to help you through some of the course load, I would always like lean on the resources that are available for you.
And there was another question that said, can you tell us more about the dental degree you pursued that allowed you to practice all the dental procedures? Is that a degree all dentists receive?
Yes, it is. Yeah. So usually dentists will get a DMD degree, which is usually kind of like on the East Coast schools, and then or a DDS degree, which is they're the same degree. And so if you just graduate dental school, you graduate with a DDS or DMD degree, which basically allows you to do general dentistry, which I didn't specialize after dental school. And the specialty programs are like orthodontics, oral surgery, periodontics, pedodontics, orthodontics. So there's set specialties after dental school that you could specialize in, if you find your forte or your niche, or that you really love an aspect of dentistry. Being a general dentist is kind of good and bad. Like you're able to do a little bit of everything. For some people, they love that. For other people, they're like really passionate about one thing. But the degree, the DDS degree, DMD degree, the degree you get from graduating dental school, gives you basically your license to do general dentistry, which is a variety of aspects of general dentistry that you get to do.
The question said that you mentioned gum surgery. What equipment do you prefer?
It depends on the case. We do a lot of gum contouring with a laser. Um, so laser gum kind of cauterizing, kind of cutting away the gum. Um, in the past, I've done like the full-on kind of like flap periodontal kind of surgery. I mean, it's nice to have different levels of procedures to lean towards in your toolbox, but I prefer a laser. Another option is something called an electrosurge, but I prefer the laser. I feel like it's pretty clean, and easy to use, and we get really good results with it.
If you can go back, would you still choose dentistry over chiropractor or being a chiropractor, and why cosmetic dentistry?
1,000%, I would choose dentistry. Um, why cosmetic dentistry? I like the artistic aspect of it. I like the fact that we're able to improve someone's smile, which ultimately can improve someone's confidence. Um, I think it's just really, really cool to see transformations in patients' personalities as well. Like if someone comes in and they're, it sounds so generic, but they're a little bit more timid, and then like, you know, they get a new smile, and then you see them over time and you just see them flourish and develop. And, you know, being, you know, being a little bit of part of that or having a little bit of influence in that, always, you know, makes you feel good and grateful. And I feel like for me, cosmetic dentistry is very, very rewarding. And it's also very enjoyable because I mean, it's technically very precise and things like that. There's so many details like involved, um, but I think it's just really cool.
Uh, what were some takeaways you learned about aspects in starting your own practice?
Um, back then I tried to read a lot of like business type books. I'd probably say like a year or two out on my own, I did hire a dental business coach. And that was extremely valuable in helping me understand my numbers, leadership, um, choosing the right people for my team. And I used that business coach for a few years, and then I felt like we kind of plateaued as an office. And then I hired a different business coach, and I feel like he really took me to that next level. So, you know, if I've been doing this for 20 years, I probably have had a business coach or like a dental business coach consultant for maybe 12 years of that, you know? So I really feel like they helped me learn a lot of things that weren't in my wheelhouse, you know, especially the business. I've also taken like just straight business courses, like couple of weekend courses, here and there taught by people who teach, you know, entrepreneurs. And that's always been helpful. For a brief period of time, I was in a group called Entrepreneurs Organization, or EO, where you meet with like other entrepreneurs in your area and develop relationships and talk about issues. So that was helpful as well. So it's kind of been a lot of being either taking courses, reading books, hiring a coach, working in kind of like a mastermind type group. So all of those things have always helped me kind of build my business understanding.
Have you come across restoring anterior implants?
Yeah, yeah, we do that a lot.
Did you learn
Yes.
about running a practice in, sorry, I didn't mean to cut you.
I was gonna say like just like dealing with a root canal tooth in the front, dealing with the implant tooth, that can be a little bit challenging. But again, there's ways to improve that situation and get things to look cohesive.
Another question was, did you learn about running a practice in dental school?
No, not at all. That's actually something that should be taught in dental school. I think the biggest, this is from my experience. This is again 20 plus years ago, but a big the big thing I wish they included in dental school would be business classes, or business electives or lunch and learns or whatever it is, just to kind of introduce people to business, and also cosmetic dentistry. I feel like there's a lack of of courses available and things like that for dental students and younger dentists. So I feel like if there's ways that people can supplement those things, that's always helpful.
How do you your
Sorry, can you say that one more time?
yeah, sorry, I don't know if I cut off. How do you pick your staff was one of the questions.
Um, You know, they say like hire slowly, fire fast. Like I never really listened to that early on, so I made a lot of mistakes like with my team members early on. I'm really fortunate right now to have three like rock stars. One has been with me for over 10 years. One has been with me for I think 7 years, and the other one's 3 years. And so I think being really choosy, but then it's also there's a lot on the owner, as in like having a clear vision of what you want being able to communicate that to your team. Because you can't get mad at someone for reading your, like, not being able to read your mind, because that's like impossible, right? So you have to be able to communicate what you're envisioning their role to be, your vision as an office, as a practice, as a business. And so we take our time choosing. A lot of our hires have come through, like 2 out of 3 they came through word of mouth, or they knew someone, it's someone that they worked with in the past, or someone I work with, a dental rep, or someone had referred this person who was looking to come aboard, or for a new position. So we've tried ads in the past, like Indeed and things like that, but the more kind of word of mouth has worked really well for us.
We had another question was, where do you see yourself in the next 10 years?
10 years. Okay, so 10 years is to continue. Well, it's interesting because, like, again, I've been doing this 20 years. I've hit a lot of our major goals. Like if it's revenue wise, if it's like downsizing my team, if it's hitting a follower count on social media. So in 10 years, I do plan on scaling back my schedule a little bit so I can focus on running my business, not just always working in my business. And then also leaving time to pursue like more of the online education stuff, courses for dentists. Um, 10 years, 10 years from now, I don't know. I could consider, maybe transitioning to hire a dentist to kind of start to take over the practice and things like that. And then maybe, I don't know, work 2 days a week. I don't know, like kind of keep my feet in the door, keep active in what we do. But maybe I think in 10 years, I probably would start to kind of slow down a little bit.
Do you think dentistry is still a career you would encourage people to go into today with the amount of debt taken on pool and with the corporations taking over the field?
Yeah, that's a good question. And it's really hard, to be honest. Like I would say if it's your passion, you should follow it. I will say you just have to kind of work a little smarter, because there's more challenges now with the debt load, with corporate dentistry and things like that. And so you just have to think out of the box. And so for us, it's like, cosmetic dentistry is a competitive area, right? And so graduating dental school and competing, if you did your own thing and competing with corporate dentistry, is a competitive thing. But there are ways to set yourself apart. If it's like, I would encourage dental students, like I've seen so many dental student content creators that are crushing it, that I'm like, I want to learn about your day in the life, like, I mean, there's ways to think outside of the box of like, starting to create content, building a brand for yourself while you're even in dental school. And so, when after graduating dental school or in dental school, like learning multiple aspects of dentistry so you can offer multiple things and get really good at a lot of different things and eventually find what you love. But starting out in a competitive field, you kind of have to think about things like that. The debt load is hard. And so the debt load makes me think maybe work for someone or a corporate office for a couple of years, get that steady income going, kind of pay down some debt services, and then potentially. So if someone said, "Hey, I want to start my practice from day one," I'd say like, maybe let's wait a little bit, get your feet wet, get your speed up, get comfortable doing these procedures, get efficient, get that consistent income, pay down some debt services, and then start your own thing. Because if you're getting out of school with that much debt and then incurring a whole bunch of debt, starting a whole practice, I mean, that's a lot of debt. And so I would say, I would still encourage people to go into dentistry. I think you just have to get a little creative on how you manage things after dental school, given the current state of affairs kind of thing.
Do you see high health risk patients?
High health risk patients?
Yeah.
I don't, but there's definitely like a need for that. aspect. And if that's someone's interest, I would definitely encourage them to do like a general practice residency or a AGD, advanced general dentistry residency after dental school, because I think those definitely give you the skills to deal with like high risk, high health kind of issue patients. But yeah.
And I think this is one of the last questions that we had was, is owning a practice more financially rewarding than being an associate, or does the business take most of the money?
It depends. It depends on how good you are with your like overhead and things like that. So there's been times where I've been like, man, like this associate's making more than me kind of thing. But um, ultimately, there's value in an associateship. Um, I feel like an associate, unless it's a really, really amazing high-end, high fee-for-service practice, it's really hard for the associate to make more than the owner doctor, unless they're working a lot more. Like unless the owner doctor is working one day and then the associate's working 4 days and they're just producing and collecting a lot of dentistry. So ultimately, I think the answer is to be the owner dentist. But I think there's a lot of things that need to happen before becoming an owner dentist, like really understanding business, working on leadership, leading teams, things that you can do as an associate that can like help you into becoming an owner dentist. So I think financially, if you're the business owner, the business does take a lot of the income or revenue. But one thing I'm learning, like even now, is like, okay, my fees have to reflect that. And so like my fees have to account for these high-end expenses we have, if it's our lab or whatever. But I think it would be financially more lucrative, probably a lot more highs and lows as a business owner. But if you're going for consistency, I'd do associate. And I still would recommend doing associate like fresh out of school. But at some point, if that's your dream, do the business owner thing, and I think it can be a lot more, financially. There's a lot more a financial, like a higher ceiling as an owner, if that makes sense. An associate, there's a level that you probably can only hit a certain ceiling, but as an owner, you can raise that ceiling or raise that bar.
I think we had a couple more that just came in, and
Go for it.
so just go over that. Yeah. Do you think you have to be really passionate about teeth to succeed in the field, or is it just wanting to help people in healthcare setting enough?
You said teeth? Passionate about teeth?
Yeah.
I mean, not really. I don't think so, because no, I think it's more about like the people. But I do think teeth are part of it. So if you're grossed out by teeth, then it's like, I don't know, but maybe you can go over that. I'm sure you can go over that. But it's definitely about people and patients and helping others and working well with others. And I mean, it's a service industry. Like dentistry is still, even though it's in healthcare, it's still a service industry. And so I think if you enjoy working with people, like the cool thing about dentistry is like good and bad. Like we're always social. Like I'm always meeting new people. Like almost like every day I'm like talking to someone new or meeting a new person, getting to know someone new. Even if I don't treat them or help them out, it's still kind of like the way dentistry is set up. And so I think with that social aspect of it, you do like I'm naturally an introvert. Like by the end of the day, I'm like, don't talk to me. like I'm done. I'm naturally an introvert, but dentistry does give me the opportunity to interact with a lot of different people on a daily basis. And so that definitely fills my cup. And if I had to retire tomorrow, that's probably the biggest thing I would miss is just the interaction with people on a daily basis. And actually, people coming to you as you being their guide. And there's when people look up to you, that's always a good thing as well. But I don't think you have to be passionate about teeth. I think you have to have a really good understanding of how you're going to work on the teeth. and get proficient and maybe get excited or passionate about that. But the teeth themselves, I don't think it has to be like a prerequisite. It's just more about the people.
Where do you get your dental science news from?
Dental science news,
Yes.
TikTok. Just kidding.
Yeah.
Uh, yeah, I mean, I feel like social media a lot. I follow I follow some really cool educators in dentistry, and I would probably lean on them as to like new materials and things like that, or case studies or research and things like that. But I think a lot of it comes from the CE courses, the continuing education courses I take. Um, like I'm going to one in January that's all about like 3D printing and digital dentistry. So I feel like that will definitely help me keep up with like kind of like the up and coming news of what's working and what's not, you know?
What is your professional take on going out of the country for cosmetic dental work?
I think there's great dentists all over the world. I think there's a lot of so-so dentists all over the world, including the, Austin, Texas, the United States. Um, I think I really understand why people go, like 1,000%. A lot of it is a financial decision, and um, I really understand why people are wanting the work. But obviously some people can't, or a lot of people are unable to afford it here in the US. And so I don't, I think it's fine. I think it's just people should do a lot of research of making sure where they're going is like a really, really good place, even if it's in a different country. Um, I've seen a lot of work that's like not very good. Unfortunately, it's been from other countries, but I've also seen work that's not so good from you know a neighboring state or a neighboring city here in the U.S. So I don't hate on it. I really understand why people do it. Um, Again, I think just as a kind of group, be it internationally, like we probably just need to raise the bar a little bit on the services we provide.
And what is the most challenging aspect of owning a practice?
At first, I feel like it was hiring the right people and having the right team. Um, I now that I've had the right people for a long time, that's less of a thing. Um, for me, it's like, nowadays it's like just time management, trying to fit everything in. Scheduling sometimes can be a little bit of a challenge because you want to help so many people, but you only have so much time in the day kind of thing. Um, but I would say the biggest challenge would be finding the right people for your team.
All right, guys, it seems like that is all we have time for today for questions. Thank you so much, Dr. Patel, for joining us today. Your presentation was very informative, and we greatly appreciated your time today. Uh,
Thank you so
Thank
much.
you so much for all the viewers that tuned in as well today. The attendance quiz will be found on the YouTube live stream, the group meet chat, and on the Instagram bio. And the quiz will be open for the next 12 hours for those who are not able to actually get on the live stream. So thank you again so much, Dr. Patel, and very good night, and see you in the next session.
Awesome. You're welcome. Thank you.